Now, tens of thousands of people in this country live with an embarrassing secret. They suffer from urinary incontinence.
An estimated 1 in 3 women here suffer from this condition, but many are too shy to talk to their doctors about it. It may happen after birth or be sparked by a sneeze or a cough. And today our resident GP, Barbara Kearns, is here to tell us what we can do to treat it. A very good morning to you, Barbara.
Good morning.
I suppose, first off, for both myself and Martin, everyone out there, define urinary incontinence.
Well, urinary incontinence is actually, there's 3 different types. The first one, and the one most people would know about, is stress incontinence. So when you cough, sneeze, run, you've a leakage of urine. The second one would be urge incontinence. So when you put the key in the door to come in with the shopping and you just have to go to the loo and you run, and some people don't make it. And the third one is just a urinary urgency. So you may not have accidents, but you need to go to the bathroom frequently, and that's often related just to taking in too many fluids or too much caffeine.
Okay, so does it affect more women than men?
Undoubtedly, it's far more women than men. Over a third of a million women are affected by this. Men also are affected, but in general that's men who've had some sort of surgery, perhaps prostate surgery. They tend to be the people who've been affected as men.
Okay. And it's not age specific, it can occur at any time?
It is age specific to some extent, in that in general we don't see it in younger children unless they have a specific problem with their spina bifida. Children can have bladder related problems. So it's more for women after they've had children that the problem would often start, even just after pregnancy, carrying around a child for 9 months, having to deliver the baby, then their pelvic floor is weak, and that's where it tends to become a problem. It then goes on and becomes worse at the time of menopause. Women lose estrogen at the time of menopause, and the bladder and the pelvic floor are all related and respond to estrogen. So the loss of that will cause the whole bladder floor, the bladder and the pelvic floor to loosen, and so the problem becomes worse, usually at menopause.
Now, I know a lot of, you were saying there, people after you give birth, it's not the same down there. As anyone watching this morning who has a natural birth, once you've had a baby, things change. But as I know myself, sneezing and coughing, all that for the first couple of months is dodgy territory. But it does get better. But for some women, it doesn't, and it never comes back. And why is that?
Well, it depends on what damage is done when you do deliver the baby, and even for women who've had a caesarean section, small women who've had a caesarean section, the bladder can also be affected, or at least the pelvic floor still affected by carrying a pregnancy. So it's not women just who've had deliveries, natural deliveries, but also women if they've had a complicated delivery and had things like forceps or the suction, even that can affect their pelvic floor. So it's a lot of women are affected, and particularly after childbirth. And when you've had a baby and the poor midwife who's running comes in and gives you 5 minutes instruction on pelvic floor exercise, it's not enough.
No, it's not.
Yeah,
it's not enough. You can't remember your own name at that point because you're so tired having just delivered a baby. So it's not fair on the poor patient, and it's not fair on the midwife, because really we're not giving them fair service, and I don't think young mothers are getting a good chance to repair their pelvic floor.
Yet it is a source of great embarrassment, and hence we're told that 25% of women will wait up to 5 years before they'll go and talk to their GP. I'd
say that's a gross underestimation.
Really?
Because so many people have these little problems, they never talk about it, and unless you ask as a GP, many times you won't get an answer. And not everybody has the time as a GP to ask the question, but really you can do so much for people. I think even with just a chat with your GP, finding out what the problem is, 50% of you can make an improvement just with discussing it with your GP. They'll give you some tips. Now, the other 50% of people who don't get an improvement, then there's lots of other therapies that can be introduced to help them that make a significant difference.
Well, physiotherapy is one of those therapies, and I went down to a physiotherapy clinic in Milltown earlier today to find out more. So Maeve, you have a waiting list of about 6 weeks to see you here for physio for urinary incontinence. What type of women are you seeing? Are they young? Are they old? Have they just had babies? Or what's a typical case?
It's a mix. There's often women postnatally, so antenatally, postnately, but there's also might be younger girls who have developed problems even before they have children, and then equally women through menopause, and we would see women right up into their 80s.
And what you do with them? I mean, you mix machinery and exercises, or what type of physio are you doing?
We assess them, and that's the most important thing, because any pelvic floor, it's like for a back, you wouldn't just tell everybody to lie down on the ground and push the back all the way up. I mean, you have to really see what's going on with the pelvic floor. So we would assess them and we would see what sort of grade of strength they have in their pelvic floor.
So you have to give them an internal exam, I
So we do an internal exam, of course with their permission, and it is possible to do it without an internal exam. We also have our ultrasound imaging machine, so we can have a look when the ultrasound head can go just on the outside on the perineum, or it can go, we can get some information from putting the ultrasound just on the lower abdomen over the bladder as well. So there are other options, but ideally we would ask the woman if she doesn't mind if we would do an internal examination, because we get so much more information about the condition of the muscles.
Yeah. So people come along then for these, you do the exercises with them here over an hour. What type of exercises are we talking about? Can you show us? Could people do them at home themselves?
I can describe if somebody sort of is in the postural neutral position, being careful not to be tilted all the way back like that. The feeling what they should have is just in that sort of slightly upright position is of feeling the muscles, thinking of the muscles around by the back passage, because in fact what a lot of people don't know is a lot of the bulk of pelvic floor muscle is around the back of the rectum. So they need to contract the muscles from the back, lifting all the way up, forwards, as if forwards towards the tummy button or the pubic bone, feeling that the muscles are left side, holding that there. If they only hold 2 or 3 seconds, that's fine, but trying not to hold the breath, lift the shoulders, brace everything, trying just to feel that on the inside, and then really, really importantly, after holding it for just a few seconds, let the muscles go completely, all right? And that's where a lot of people get it wrong. They're tightening up, they tighten, and they stop tightening, but the muscle is still actually quite high in tone, and they tighten again, and all the time the muscles are spending a lot of time quite contracted, quite tense, which is not a good thing for muscle training. So release completely in between, then maybe try and work up to holding that for about 10 seconds, 10 repetitions of that. 3 or 4 times a day would be fantastic, and then improvements can be seen from a week, from just training the brain how to hold on to those muscles, to a couple of months where that action becomes automatic and the muscle fibre actually really develops.
Should you be sitting down when you do these exercises, or standing, or? Initially,
it's in order to find the muscles, it might be a good idea to eliminate posture by lying down on the back with the knees bent up.
And how do you know if you're doing it right?
It's a good question. Of course, I'm a chartered physiotherapist. I'm going to say go to see a chartered physiotherapist, and that's how you know. And certainly that's what we promote, because unfortunately a lot of people would say, well, I tried physiotherapy but that failed, and now can I have surgery? And what we would say is it's very specific what you have to do, and to have that help of an internal examination for those who are comfortable having an internal examination, but to have that help to know that what you're doing is absolutely right is key.
Okay, how many sessions would you need to, can you cure it?
The results are pretty good. A lot of the research would say about 70% cure rate for this. And it depends, of course, what a woman wants to do. So if somebody wants to get back to being a professional trampoliner, it's going to be tricky. Trampoline is deadly. So you got to just aim. Do you want to go back running? What do you want to do? Quality of life is where it's at. So most women want to be able to run around after their children, go out for walks, not to have to wear pads, not to be self-conscious, not to worry what clothes they're wearing. So, just to get people with them back to the sort of quality of life, what they're looking for, that's what we want.
It's funny, that girl Maeve was telling me that she would have seen people who would have had it for up to 7 years before they came to her for treatment, which is a long time to be leaking, and when it's as easy as that to get treated.
Yeah. Can age prevent a cure?
No.
So
you won't
at
get
any age,
good a response perhaps, but no, absolutely not. So any age.
Okay.
I think that's important maybe to emphasise. It doesn't matter how old you are.
Okay.
That horrible, the smelly granny. A lot of people would say that I don't want to be a smelly old lady. It's terrible, but they say it and it's true. Mm-hmm. And that's what you don't want to be.
Surgery is the next step after that, isn't
it? Yes.
If that doesn't work, if physio doesn't work.
Well, also medication. So if you have an overactive bladder, it's actually medication.
Okay, and then the last result.
And the very first thing is caffeine. Caffeine, loads of women drink 10 cups of coffee a day and tea.
Yes.
Yeah.
So caffeine, this 2 litres a day, that's not correct.
Cut down on your caffeine intake.
Cut down your caffeine, cut down your fluid intake to less than 1.5 litres a day. Get physio if the problem is that the bladder, the pelvic floor isn't working. Some people are going to need medication too, so that the bladder doesn't keep telling them they need to pee when they don't. And lastly, there is very good surgery that's now available as a day case procedure, so minimally invasive with really good results.
Okay.
What's it called, or what?
TVT or TUT, transurethral tape.
Okay. Of course, the other thing to bear in mind is that it really can impact on your self-esteem.
I think that's a very important one. I mean, that's why you want to do it. That's why you want to get treatment. Self-esteem, and you want it to take part of with your children's lives. That's what you want to do. You want to be part of your children's lives. And these women can't run, they can't go after their kids. So it's really important that we know the problems there as GPs so that we can help people, because there's so much we can do. And I hate to think that, you know, so many women are out there, and men, who feel that this is their secret that they can't talk about and there's nothing that can be done when there's so much we can offer.
Well, as we've already mentioned, we thought it was only about 25% of people not going to their GPs. You're telling us that it's an awful lot more than that. So please talk about it.
Absolutely. Please ask your GP. Self-esteem is very important, getting out there. Even productivity at work, having to go to the bathroom 20 times during the day, that's a lot of time lost at work. And if we can do something for people, well then just say it to your GP, because it's a secret that people aren't talking about.
And I suppose people can do these exercises at home as well. I mean, I know Maeve was saying you have to be kind of taught how to do it, but I mean, even just practicing yourself as well.
They can, though. I would give a caveat that you can do these incorrectly and make the problem worse. So actually, I would say, people often say to me, well, will you show me? And I'd say, look, I'm sorry, I am not qualified as a GP to show you how to do them properly. I think Maeve, and I would say Maeve Whelan, manual therapy is far better than a lot of gadgets that some physios use. They really do not get the same results. I mean, I really feel the manual therapy is so much better that I really don't refer it to my patients to any place else.
Well, it's something as well that when you have a baby, you're not really warned about this before you have a baby. And then, well, I wasn't. And then after I had my baby, it was like, oh, go down there's a lesson on at 2 o'clock for your pelvic floor muscles to get them back into shape, which was like a half-hour kind of class. I didn't have a clue what they were talking about. I said, what are you talking about? My pelvic floor muscles are fine. And I did the class, and that was the end of it. But I'd never even been told.
Well, I think kind of like you go to your GP for your 6-week check for the baby and their shots. I think every patient should be sent to a physio who knows how to do manual therapy at 6 weeks and shown how to do it, and then see them again at 3 months. I think the government, if they introduce something like that, would in the long run save a huge amount of time and, more importantly, improve people's lifestyle significantly, because they can exercise, because they can run, because they're not afraid to leak.
Their mental health is saved too, because I'd imagine there's a lot of people who wind up getting depression because they're suffering in silence.
And it's totally treatable, and that's the main thing. So hopefully we got that message across today.
As always, lovely to see you, Barbara. Thanks so much.
Thanks so much.